Hi, everybody. That's a tough talk to follow, but I'll do my best. I'm Rachel Eiring. I'm a PA at Mayo Clinic, and today we'll be talking about the role of various allied health professionals in neuroendocrine cancer care. So we're going to discuss the care team model and how various care teams intersect to drive multidisciplinary care. We'll recognize the role of advanced practitioners and other allied health professionals and identify opportunities for patient engagement with different care team members. So as we've been hearing all morning that neuroendocrine tumors are rare, they're a diverse group. Not one single patient I've ever cared for has the same treatment pathway, set of symptoms, what they tolerate, things that impact their quality of life. They sometimes are delayed diagnosis, vague symptoms, diagnosis later into their journey. Care can be complex. There's a lot of psychosocial needs that we need to address when you're living with a cancer for many years. We need that multidisciplinary team, and we need to individualize treatment approaches. So it really comes down to this team-based care with the patient being the heart of the care team. Physician-led care, whether that physician we're talking is on the medical side of things or the surgical side of things, and then an entire team that works with the care team from pathology, advanced practitioners, nurses, pharmacists, social workers, administrative support, dietitians, PT, OT, counseling. So it really kind of all revolves around that patient journey. And that's in my lens when I think about my medical oncology role. But every single discipline that needs to touch a neuroendocrine cancer patient's journey comes with a big team like that. So we need to coordinate surgery, interventional radiology, as we were just hearing, radiation oncology, nuke medicine, our various experts in the medical specialties, palliative care, pain clinic, and really importantly, and often not talked about enough, the community provider who allows patients to get care closer to home, because most patients don't live right outside of an academic center. So how do we do this? Sometimes it's as simple as picking up the phone and calling a colleague, talking across that multidisciplinary service line. Sometimes it takes 4 different specialties to come up with a treatment plan, and we're messaging. Some places have multidisciplinary clinics where the patient has one appointment but can see 3 or 4 different specialties in the same afternoon. And sometimes we have tumor boards. But at the end of this, the goal is so that when we get back to the patient, we have a plan in place, and what could have been 6 different appointments gets taken care of in 2 appointments. The first one where we get to know you, the second one where we've coordinated all of these people together to make the best recommendations we can. So this leads to challenges, because that's a lot of things happening behind the scenes when you want to know, why does it take so long for the team to get back to that portal message? All that magic's happening behind the scenes. But care can be fragmented. We don't all have the same electronic medical record, so sometimes we're relying on old-fashioned faxing records from one location to another. There can be communication gaps. You just heard, you can hear these kind of brilliant plans, but if they don't make sense to you, how are you supposed to feel empowered to navigate your own care? Can sometimes be delayed in access. There's not enough healthcare providers to meet every patient's needs, and so how do we make sure that when people need timely care, that access, that they get kind of moved up? There can be challenges navigating insurance, financial barriers, logistical barriers. Right now I work out of Rochester. There's a ton of construction going on downtown Rochester. How do I navigate downtown Rochester? How do I get to this conference in downtown Minneapolis? How many people thought about where the heck am I going to park to get here today? All of these things are one tiny piece that goes on your plate. So if we can make it a little bit easier, we want to do that. So let's dive in to understand how these different roles will help you overcome the challenges in your care. So we're going to start with, what's an advanced practitioner? An advanced practitioner is a medical provider or clinician who's undergone training in medicine. We work alongside physician colleagues to expand access to care in a collaborative practice. You will hear advanced practitioner, advanced practice provider. Those are interchangeable terms. And this is a bucket terminology. It really fits several credentialed roles. Nurse practitioners fall into this. Physician assistants fall into this. To make it even more confusing, the PA role is undergoing a name change, so depending on what state you're getting care in, it might be a physician associate. Your CRNAs fall into this, and midwives. Hopefully we're not dealing with midwives too much in neuroendocrine care, but most likely some of you will interact with NPs and PAs sometime on your journey. So a nurse practitioner has completed a master's or doctoral training program to have that advanced degree beyond the RN role, completed both didactic and clinical training within that. A PA is trained in a medical model, usually a master's degree, and we are really trained to be in a team-based medical practice, working both in primary care, specialties, surgical practices. So where might you see advanced practice providers in your journey? They might be your primary care provider. Perhaps they're involved in the screening that led to your diagnosis. Maybe you were somebody who had one of those vague symptoms and got referred to a specialist and saw a NP or a PA as part of that initial workup for abdominal pain and diarrhea. You'll see them in community and academic medicine, private practice. You'll see them across the different roles of the cancer treatment team, and they have a lot of expertise in symptom management, survivorship care, and end-of-life care. So what can we do? A lot of what we do is behind the scenes, but with the visits with us, you might go, I don't quite understand how this is different than the physician. And that's because for some of the day-to-day tasks, we order tests, we prescribe therapies, participate with you, the patient, in shared decision-making, participate across that perioperative surgical pathway, provide management, psychosocial support, help coordinate the care. We can participate in care in clinical trials. We triage patients to try to expedite that care journey when somebody has an urgent need, and we help answer questions. And so where I think what's unique is when I don't know the answer, which a lot of times the answer is not black and white. We have the benefit to step out, to talk to our team, to talk to our collaborating physician, and give you the best recommendation we can in that collaborative practice model. At the end of the day, though, advanced practitioners expand access to specialized care so that we can get more patients' needs met. So when we think about, we've heard, how do we put all of this together? We have to understand the functional syndrome. Okay, we've wrapped our head around that, but now I've got a patient who has altered anatomy, and I'm giving them side effects from treatment, and so how do I balance these different things driving symptoms and quality of life? What has that done to their nutritional needs? And how do I help identify which other allied health member should I get involved in their care so that we can drive whole person care? At the end of the day, our goal is to ensure that every patient who has a neuroendocrine cancer has access to subspecialized care when they need it, for multidisciplinary care, for clinical trials, for symptom management. But importantly, coming back to that community provider, we want to make sure the pieces of your journey that can be done closer to home can. So this looks like sometimes a partnership where you see your expert team at the academic center every 3 to 6 months, and the pieces that can happen on a weekly or monthly basis closer to home can. But all the team members are helping coordinate this. Outside of the clinical role, advanced practitioners are involved in a lot of other things too. Research, quality improvement, trying to overcome access challenges through novel healthcare delivery innovations, patient advocacy, society engagement, whether that be something like NANETS or another society, patient education, support groups, community engagement. So to highlight this, we're going to talk a little bit about Mr. X today. So Mr. X has newly diagnosed stage 4 small bowel neuroendocrine care. He's seeking a second opinion on treatment and hopes to get a better understanding of his disease. He has symptoms from his carcinoid syndrome and has been having some partial bowel blockage. He has an appointment with medical oncology and is meeting the PA and the oncologist. The PA's role is to confirm the history, make sure it makes sense, what has this patient been through to get here today, provide education on here's the grade of your disease, here's what carcinoid syndrome is, look over scans, review symptoms, and just start discussing that symptom management plan. And then the PA is going to step out of the room and talk to the oncologist and put their heads together to think about what is the cancer treatment plan. The oncologist will go in, finalize that plan. They decide to start lanreotide and refer to surgery to consider removing the primary tumor. Oop. What about the other important allied health members that are part of this care team role? So we'll now move forward to each of these roles. So we've kind of made sense of the advanced practitioner's role. All of those other roles we're about to dive into are a key part of helping to ensure that we're meeting that whole person care through physical, emotional support, nutritional support, social and logistical, with goals that we help people have the best quality of life they can. We ensure that complex plans are a little bit easier to adhere to, overcome those barriers, make sure that people understand what they're going through, have the support to be able to navigate their care. So nurses, I couldn't function without the nurse on our team. They're involved in every single specialty we've talked about, and they provide education. They help us make it make sense. We all need to hear things 7 different ways, 7 different times, and that's eventually it starts to stick and make a little more sense. They'll be involved in symptom assessment and kind of escalating things up to the physicians or advanced practice providers. They'll provide that emotional support, help some of that care coordination behind the scenes. They're involved in research, and they act as a strong patient advocate and liaison between the patient and the provider. So Mr. X, he was seen after his surgery back in clinic, and unfortunately he has worsening diarrhea. It seems to be worse right after his lanreotide injection, but never quite goes away. The PA says, oh, this is multifactorial, you've got carcinoid syndrome, you're on lanreotide, that's causing a side effect, and your surgery now gave you something called bile acid malabsorption. We're going to throw a bunch of medications at you. You're going to continue your lanreotide for your carcinoid syndrome. We're going to start some pancreatic enzymes to see if that helps manage your lanreotide side effects. And maybe we'll add cholesterol for that bile acid malabsorption. But let's start with one thing first and see how the pancreas enzymes go. They have the patient do a food and symptom journal. And then a week into this, the RN calls and does an assessment to see, are things better or the same? They provide further education on how do you take those pancreatic enzymes and reassurance that maybe you should take an extra one when you eat this or that based on that food journal. And then follow up with the clinician on the team to say, things aren't better enough, we better pull the trigger on that cholesterol. Overall, we're able to improve symptoms without needing another follow-up appointment because that nurse was able to circle back to the patient. What about pharmacists? Pharmacists, you'll see them in the traditional role in a dispensing pharmacy on the hospital side of things in the cancer treatment unit, but more and more we're seeing them embedded into the care team and having face-to-face visits with patients. They help in preparation, dispensing, monitoring, and safety of medications, provide education, help with that adherence, and also are involved in research. So Mr. X is participating on a clinical trial. He'd like to add some supplements to his supportive care routine. It's called Liver Fantastic 2000. And he asks his PA, can I take this? I don't know, what the heck is that? The PA brings the bottle to the pharmacist who looks at the active ingredient list, looks at what pathway the active ingredients are cleared through. Are they cleared through the same drugs as the pathway as the clinical trial drug? Checks the study protocol to see if there's any restrictions on which drug classes a patient can take while they're on the protocol, reviews any evidence for the active ingredients, what are the pros of this, what are the potential side effects, and at the end of the day, we're able to come back to the patient with shared decision-making about potential risks of this supplement, potential benefits, and so that Mr. X can feel empowered to make an informed decision. Please tell us about your supplements. Patient navigators. This is a non-clinical role. They really help coordinate some of the ancillary services, the transportation, the lodging, how do I get through that construction. They can help with financial concerns, disease-specific inquiries, emotional support, and provide culturally sensitive care for specific patient populations. Social worker. They help with counseling and provide resources around grief, adjustment to illness, caregiver support, advanced care planning, psychosocial stressors. So Mr. X is now feeling concerned about his ability to work. There's a little bit of a toll through all of this journey. He's feeling more tired. The burden of appointments is getting to him. He's got to take every other week off for this clinical trial. Worried about the financial impact. What about his insurance if he's not working? Can he afford his care? Can he continue to travel? He just isn't even sure where to start navigating this. He's referred to the social worker who helps him explore what options he has for disability, gives guidance on the next steps to start completing that paperwork, works with that patient navigator to identify discounted lodging and travel options, and provides validation of his feelings and what he's going through and how hard that is, and ongoing counseling to help him adjust and cope with that. Mr. X feels that this plan is a little more attainable than before his visit, and he feels supported in his concern. Dietitians. Wouldn't it be great if we could all eat whatever we wanted, whenever we wanted? But we know that food is one of the really hard things around this journey. Dietitians are trained to support patients who have dietary changes that impact meal planning, daily life, and how to support those. And we have a lot of factors in neuroendocrine cancer patients that impact it. Altered anatomy, functional tumors, food that triggers syndromes, medication side effects that makes that work, and multiple conditions. And it takes somebody to understand that so that you're not just getting the blanket cancer recommendation on eat higher calorie food. Great, thanks. So Mr. X is losing weight. He's struggling to find foods that he can eat that sit on his digestive tract. And he also has diabetes and on that lanreotide that's spiking his blood sugar, and the bread sits well on his digestive tract, but it spikes his blood sugar, so he just feels like he can't eat anything. He's referred to the dietitian team who reviews his medical record, the food and symptom journal that was provided. The dietitian tailors, here's your kind of macro goals that you would need to maintain adequate nutrition. Here's a potential start for meal planning that I hope will work for you in context of your altered anatomy, your diabetes goals. Here's some resources, and let's follow up with your clinician to talk about your pancreas enzymes. At the end of it, he feels like he's got a little better understanding of what he can do day to day to get some variety and not just eat the same things. But it's going to take a couple follow-up appointments to make sure that things are making sense. PT and OT. So these are individuals trained to support patients to recover and maintain function through movement or other daily activities. So Mr. X, unfortunately, his course was complicated by a pneumonia. He's in the hospital for a week with it and just really takes a toll where he's more fatigued and run down. During his hospitalization, he has a physical therapy, occupational therapy assessment, and they recommend on going home, let's get some equipment for your house because his bedroom and bathroom are upstairs and stairs are too hard right now. So they bring in some resources, a bed so that he can be on the main floor, commode, and he's going to have twice weekly home physical therapy to work on his strength. Over the next 6 weeks, he is able to regain that strength and kind of resume his prior normal life, but takes the hard work. Clinical trial research coordinators. So these are non-licensed roles. For anybody who's participated on a clinical trial, there's the care team we've been talking about. There's the study sponsor, and then there's the IRB board, who usually makes sure that we're doing things that are safe and ethical when it comes to research. And there's somebody who has to coordinate those three partners within a clinical trial space. This is part of the clinical trial coordinator's role. They make sure that we are doing appointments and testing according to clinical trial protocol. If there's a question we're not sure how to answer on this protocol, they'll escalate it to make sure that we are talking to all of the key stakeholders. They'll collect study diaries as part of that protocol, and some trials have financial reimbursement. So this is kind of becomes your first go-to for all things, I'm not sure about this on the clinical trial. Additional team members, so some of the additional non-clinical roles, scheduling, medical assistants, administrative assistants, they are involved in sharing of that record collection, scheduling appointments, phone call intake, updating information in the electronic medical record, making sure the paperwork gets done so that if you had to wait for me to do it, you're not waiting a month, they get it done so I can sign it and verify it's correct. They are the Get People Done team, and they are the magic behind healthcare, so we have to give them a shout out. So at the end of it, hopefully you feel a little bit more aware of the different roles. You can figure out, if I don't understand something about my journey, where can I ask a question? Who can I talk to learn a little bit more about it? How can I make sure that I'm informed in decision making? How can I be a partner in the management of my own symptoms and side effects? So some things will be making sure you have the education to manage it at home, but when those things fail, how do I reach out to my care team so that I can engage with them to feel better? And what are my resources for that psychosocial support to focus on resiliency and coping? It takes a big team, but everybody is here with the patient as the top priority. Trust and open communication with the patient and the entire care team is key to success in this. All right, and I talked 8 minutes faster than I practiced, so.